Hi, this is Mary Colbert. Welcome to Dr. Don Colbert's Divine Health Podcast. We are so excited to be here today to talk to you about something that is so important to your health, and this is testosterone for women. If you missed the podcast from last week, you need to listen to the one for men. But this week, we're going to be talking about it for women because this is such an overlooked subject. It's really, really important that you listen in, get a pen and a pad, write down this information so that you can learn about the power and the importance of you, ladies, yes, you, and your testosterone.
Well, Mary, women are hormonal beings. And believe it or not, women, you have not only estrogen and progesterone, your key hormones, but you also your body produces testosterone. Yes, your adrenals produce it and your ovaries produce it. But something happens right around age 40. You have three key hormones, and these hormones start to fall precipitously. The first one that falls, number one is testosterone, starts to fall at age 4, usually at age 40. It declines rapidly. At age 40, women usually have about half the testosterone that they had at age 20. And when that happens, things change. Marriages change. Divorces start to occur. Libido goes, romance goes, and all of a sudden you've got an angry, irritable woman that's many times depressed.
Is the testosterone our coping mechanism? Is it
testosterone, I'm going to talk about it in just a sec, but
Okay.
I'm telling you, what testosterone does in women is so important. And women have about 1/10 the testosterone level of a man, but at around age 40, all of a sudden something happens, and the husband says, "What happened to you? This is not the same woman." Her libido goes. She says, "That part of my life's over." And
I can't have kids, so I don't care about it anymore.
That's it. It's done. It's amazing how so many women, this is common because it usually occurs at age 40. Now, the second hormone that drops precipitously about 5 years later is progesterone. That's the sweet hormone that keeps women from getting grumpy. All of a sudden, they become super grumpy. And the third hormone that falls around age 50 is estradiol. So those are your three hormone dominoes. But the first one to fall almost always is testosterone. So let's see what testosterone does in women. The symptoms of low testosterone in women, and again, I check this on every woman. And the levels for a woman, now listen to this, these are your lab values, and these are actually dropping too. Female age 20 to 49, the normal level according to LabCorp is 8 to 48. If your level's 8, women, you're not going to feel good at all. If you're over 49, it drops even more. Level 3 to 41. If your level's 3, that's normal, but that's you'll feel horrible, okay? And so let's look at the symptoms of low testosterone in women. Number one, tired. But it's worse than tired. These people describe it as bone tired. They say, when I get out of bed, I am bone tired. I don't know what's going on. And it usually occurs right around age 40. Also, they can't sleep well at night. They start to get these night sweats. It's amazing how when I put my women that have night sweats on testosterone cream or pellet or, sometimes shots, rarely shots, it's amazing how those night sweats start to go away. Also, inability to feel rested in the morning, as well as depression. Remember, testosterone is that super antidepressant. It raises norepinephrine, which is a wonderful neurotransmitter that gives you energy. It also raises dopamine that makes you feel wonderful, as well as serotonin. It raises all three neurotransmitters. Also, another symptom of low testosterone is weight gain, especially belly fat. And that's when accelerated belly fat starts to develop when that testosterone level crashes, as well as little no sex drive. The sex drive diminishes and many times goes away. The lower the testosterone, the lower the libido or sex drive. And also increased irritability, increased grumpiness. Migraines actually can get worse. Testosterone helps a lot of women with migraines. Their muscles get weaker. They're not able to climax sexually. And it's amazing how we're able to restore that ability in women with just a little testosterone cream. And then the brain fog hits. And it's amazing how testosterone helps brain fog in women, as well as they start to get achy joints. Testosterone, I didn't mention this for men, I forgot, but this is real important. if testosterone is one of the best anti-inflammatory hormones or substances on the planet. When men and women start getting achy joints, we use a little testosterone cream. You can put it behind the knee, and it is amazing how it helps with inflammation, as well as other supplements. I put them on what I call my joint support program. We put them on our collagen. We have this special chicken collagen that is so healthy for joints. A scoop twice a day into the joints are much better than they can go down to one scoop once a day. And I use this other supplement called Synovix, usually 2 or 3 tabs twice a day until the joints have healed. Then we can reduce it. And sometimes if it's real bad, I'll add our curcumin boswellia, 2 of each twice a day. So again, we have a great joint restoration program, again with testosterone. And then what happens, women start to get thin skin. Testosterone keeps your skin thicker, women. And it also, as your testosterone is lower, you get increased wrinkles. And the biggest is lack of zest for life. They just used to have plenty of zest and zeal for life. That's gone, because when testosterone goes, that zest for life usually goes with it. And so that's why testosterone is one of those critical hormones for women. And many women are on medications that are lowering testosterone. One of the biggest ones, statin drugs. Now, again, women, when your cholesterol's increased, that's generally a sign that your testosterone is low. Because your body, when your testosterone's low, your liver will crank up production of cholesterol in order to produce more testosterone, but the testosterone is not being produced. So the liver keeps cranking out cholesterol, so your cholesterol level goes high. And so your doctor puts you on a statin drug, which lowers testosterone even more. But also, generally, when your testosterone's low, you get depressed, and they'll put you on an antidepressant. Because remember, testosterone's the best antidepressant, but antidepressants lower testosterone levels even more. So you see how it's getting worse and worse. They're lowering it even more and more.
Now, one of the things that I know, I can hear the women listening right now immediately, which is a major concern for women. If I do testosterone, will it make me lose my hair?
Oh, very good. Very good question. Only about 5% of women will lose hair with testosterone, but don't need to worry. Any patient that we see, we give them the option to start on we put them on finasteride, usually a half a tab, 2 or 3 days a week, and it blocks the dihydrotestosterone so they don't lose hair. Or you say, I want something natural. We can use pumpkin seed oil or a little saw palmetto that also helps. But again, we don't want to jack the testosterone up sky high that causes hair loss. We just raise it to a good optimal level. And then what happens, the vast majority of women lose no hair at all.
Now, I remember one patient, you came in, her husband was a nutritionist, and he was treating her himself on the testosterone. I remember she came in and she had hair on her chest.
Oh,
and
yeah.
You looked at her and you went, oh my goodness.
No.
What
What happened, this was like 25 years ago.
Yeah, I remember that.
This lady came in, she had a real deep voice, and she was about 60. And I said, Ma, your voice is deep. She said, yeah, my voice is so deep, they kicked me out of the choir, the church choir. I used to sing in the choir.
It's true.
And then I said, Ma, I heard testosterone levels like 800 or 1,000. It's something ridiculous. And I said, my goodness, a person with a testosterone level that high will grow hair on the face and hair on the chest. And she said, that's right, I got to shave every day, talking real deep. And plus, look at this. And she opened her blouse up, and she had hair on her chest. I said, oh, my gosh, they've way overshot her. I said, we got to fix this. That's a true story. But
that's a true story. So I know people hear these
She was on
stories.
Testosterone shots, though. Her doctor had put on testosterone shots.
And so now, but my point is,
well,
folks,
you can take too much
of anything. Right. There's a happy place that your body wants to get in, ladies, so that you feel good and you have energy and you don't have depression. That's the message here. Stay on point.
Okay, now let's talk about the benefits of testosterone in women. These are known benefits. Now, this is in my book, the Hormone Zone. So, number one, it slows and stops and sometimes even reverses cellulite. Most women hate cellulite. Why is that? Because testosterone opens up those blood vessels, supplies oxygen to the subcutaneous fat, and prevents cellulite, or sometimes will slow it or stop it, okay?
Wow.
Also, it helps women lose weight. When your testosterone crashes, guess what comes? Belly fat. When we raise it up to a good level, to a normal level, an optimal level, then all of a sudden women have more energy and they build more muscle, their metabolic rate increases, and they're able to burn more belly fat. It also tightens the skin. When skin gets thin and you get that crepey skin, that's because two hormones are usually low, testosterone and growth hormone. Well, testosterone also helps to moisturize the skin.
And thyroid.
So does thyroid, but also testosterone. And another common symptom we hear with low testosterone is dry eyes. And so a lot of my women with dry eyes, I have them put a little teeny bit of testosterone cream on their upper eyelids, and it clears a lot of their dry eyes. It's amazing how that works on a lot of women. But also the biggest thing is energy. Women with low testosterone usually are the bone tired, and testosterone gives them that energy boost, especially when their testosterone and thyroid are sluggish. We boost them both, and the energy comes up. But they build muscle, it restores the libido, it improves their memory, it gets rid of many night sweats. Night sweats, if you're having a lot of night sweats, that's a sign testosterone's too low. That can be estrogen, but it's usually testosterone. One of the big things, it decreases inflammation. It helps joint pains, muscle aches and pains. It's just a great, wonderful anti-inflammatory. It strengthens your heart. Now, this is a big one, ladies. It usually improves and sometimes stops a leaky bladder. So many women, when they get to 50, they put on that belly fat. It's like putting a watermelon on top of a bladder or a water bottle. Think of a hot water bottle, put a watermelon on it, it starts to leak. Well, that's what you're doing. All that belly fat is sitting on top of your bladder, and that bladder is weakening, and that bladder neck, it's losing the normal angle, and the bladder is sagging, and so you're leaking, and so you're dripping, and you're having to wear a pad. Well, what's so neat is when you do get on a little testosterone cream, we put a little testosterone cream in your private part, and then we have you do Kegel exercises. It'll tighten that up. It'll help so many women. And I've had so many women say, thank you. That's the one thing that bugged me the most. I don't have to wear my pad anymore. They were always leaking, and when they'd cough or sneeze, be leaking. And so it helps that tremendously in so many women. And it also helps protect you from bladder infections. But one of the most important thing, listen to this, women, those people genetically predetermined for Alzheimer's disease, it can be delayed, according to research, by 10 years by replacing testosterone around menopause. Isn't that amazing?
Wow.
So testosterone protects the brain. And I tell my women and my men, it's the best nursing home insurance ever, because there's three things that put most people in a nursing home. Listen to me closely. When you're over 80, what happens is most people over 80 are feeble or frail. They've lost a lot of muscle. Their muscles their skin hangs on their arms. That's frailty and feebleness, and it'll reverse that. Now, I got to get your level up to high normal, or sometimes high, over 100 women to do it, but we can usually reverse feebleness. Also, osteoporosis will put you in a nursing home. Testosterone builds 8.4% bone growth per year when we get it to that level that we need to get it. So it's going to protect your bones and start reversing osteoporosis. We've seen so many patients with osteoporosis get it reversed, not just testosterone, also a bone-building program. We put our patients on Silical 1 and Silical 2 that are bone support nutrients, as well as K2, and sometimes we'll use high-dose boron and sometimes strontium. But we reverse osteoporosis without meds all the time.
Don, I'd like to share a picture paints 1,000 words. One of my favorite stories was the one of the patient that in your office in Texas, because you have two offices. You have one in Texas and one here in Orlando. And we're here in Orlando right now. But I remember when this lady came in with her family. She was in a wheelchair. She was very feeble, 80-something years old, early 80s. And they just brought her into you to help just her health, and she was weak and she was feeble. And you went in there and you did your thing with your patients like you always do. And one of the things you did is you put her on hormones for this reason, the bioidentical hormones.
She was feeble and frail, correct.
Right. And then it was amazing. A year later, this woman comes into the office for a follow-up visit with you, and she has this young man with her. Not young man, but a man, about about
Oh,
her age.
Mary, let me tell the whole
No,
story.
no.
Hold
Wait
on.
a second. I got to tell this. Let me tell this, and
I
then
got to tell
then
the
you
whole
can
one.
think.
Okay.
So she comes in with this guy, and we think that's her son, but he is about her age. But he learned about the hormones
But
too.
Mary, this man was tall,
Yep.
distinguished. Her son was 55. That was Agnes. She was in her 80s, and this time she came with this tall, distinguished older man. Now he had broad shoulders. He had a small waist. He had a big smile on his face. A very handsome-looking guy, and I was shocked her son wasn't with her. And I said, "Is this your, one of your sons?" And she said, "No, this is my fiance." She says, "I met him at the gym working out."
True story, folks.
And she says, "And we're getting married." And she says, "I can't wait for the honeymoon."
This was the same person who came in a wheelchair, fell with. Now she
Well,
says,
no,
"Yes,
she
my
had-
family's all upset because I'm getting married." You got her so
Exactly.
turned around.
Well, no, she was a train wreck when I
know.
first saw her.
I
She
know.
had severe osteoarthritis. They're wanting to replace her knees and her
know.
hips. She had severe osteoporosis. She was literally ready for a wheelchair.
Well, she was in a wheelchair.
And,
They
well,
brought her in a wheelchair.
Yeah, and then they wanted to put her in a nursing home. Or
That's what it
kids did.
was,
That's what
yes.
it was. You're right. And so we put her on and I put her on pellets. I remember back then I said, well, we got to get our big guns out. So we used the pellets. She came in every 4 months for her pellets. And then I'll never forget, about 3 months after doing this, of course, I put her on once she got her energy back, I put her on the recumbent bike, and I put her on all these nutrients too, and anti-inflammatory, natural bone-building supplements, joint support supplements like I just talked about. But then I'll never forget, 3 months after on the program, she called the office and she was crying. And the nurse says, "Everything okay, Miss Agnes? Everything fine?" She says, "I'm just so happy. This is the first day in years I'm not in pain." And she was just so happy. And then eventually, as you know, she lost about 75 pounds. She was working out in a gym, met her fiance, and is ecstatic. Has her life back. No longer is feeble. No longer worrying about being in a nursing home.
And she's
no longer having
86, 87 now?
pain. She's in her high 80s.
Yeah,
now.
she's in her high 80s.
Living
going
independently. Yes.
With her and her new husband and happy. I mean, it's so thankful. She felt like, Dr. Colbert added years to her life. And, this is the message that we want to bring to the people is, we're going to age, but you don't have to get old. And I think that's the message that you need to hear. We're all going to age. We know that. But you don't have to get old. You can maintain good health, good energy, a good zest for life. And that's what I really believe is the Lord's will for all of us, is that we continue with life and continue to dream and continue to do things for Him and not just cave in and give to a nursing home. God has an answer for everything you're struggling with. You've got to get a hold of Dr. Colbert's book, the Hormone Health Zone book. The Hormone Health Zone book is so chock full of information because we are hormones. And you go to our website, Dr. Colbert, DrColbert. We have our hormone supplements on there. Ladies, this is an important supplement for you to get on as you do your natural bioidentical hormones. I know that the big question a lot of people have as they're listening is, now, wait a minute, is this going to cause cancer? Because that's the big,
Well, let me answer that
fear.
question, because just like men are afraid to use testosterone thinking it'll trigger prostate cancer. Well, again, if you have prostate cancer, you don't want to be on testosterone. But it helps prevent prostate cancer. Well, the same in women. Testosterone helps prevent breast cancer.
That is important, Don, for people to hear that.
Absolutely right. And so then also we put them on our hormone zone that contains the DIM, the diindolylmethane from broccoli. It shuttles that estrogen down that 2-hydroxy pathway that helps, again, protect the breasts. So that's why testosterone, along with our hormone zone, will actually help protect them from breast cancer. Now, we still, women, once you get your mammograms regularly, as your doctor tells you to, but you'll be more protected with the testosterone, with the hormone zone. So it actually protects you. Now, I see a lot of women who've had breast cancer. And I put a lot of them on my testosterone pellets with Arimidex, which prevents the testosterone from aromatizing to estrogen. Because many women have had breast cancer that have that their doctors, oncologists want to keep their estrogen levels real low because it can fuel cancer. So we have a little testosterone pellet with a little Arimidex that prevents the testosterone from converting to any estrogen. So it keeps it low. And these women feel amazing. They don't have a lot of women are on Arimidex or estrogen blockers, and they have severe fatigue, severe bone pain, severe muscle aches, and they just feel horrible. Sometimes the treatment is worse than the disease. And so I put them on this, and the women feel amazing. I've got women I've had on it for years. It protects them against breast cancer, and they have their life back, and they just absolutely love it.
I think what people need to hear, and you really need to hear this, synthetic is what we don't like. Synthetic hormones we want to stay away from in every way. You want the hormones that are natural and friendly to the body. We call them bioidentical hormones.
And again, I get permission from their doctors, and a lot of women are just and most doctors don't know the benefits of testosterone in protecting women from breast cancer. So again, it's important if you need to educate your doctors, and also some may need to get your doctors a copy of this book.
That's the most important. I think when doctors read this book, I can't tell you, Don, how many that have called the office and left messages. Hey, tell Dr. Colbert, thank you for his book on the Hormone Zone. Man, that was a great book. I've learned so much. And these are doctors calling the office, leaving messages like
right.
that.
Now let me explain. Women are saying, well, how do I boost my testosterone? What do I do? Will my doctor prescribe it? Well, we check the testosterone levels. We check your estradiol levels. We check your other hormone levels. And if you're having lots of these symptoms and your testosterone is really low, we usually start most of our women on testosterone cream. Now, if you're having those bladder issues, you're having all kind of leaky bladder and you're having to wear the pads, it works. Or if you're having problems with libido, many times we just use a little cream right in the private part, and it does the trick. Other women, we use a higher dose of the cream. We can put it behind their knee in the morning or at the bend of their elbow, and it helps in the morning and we rub it in well, and it gives you tremendous energy. And we put it in a special base called a Trevis base, which helps it be absorbed much better. Now, some women say, well, it makes my skin itch. So for those, we have them use the testosterone cream at night on the soles of their feet. Okay, some women, all they need is just a little sublingual tablet. Some women, if it's really bad, they're having terrible night sweats, they have frailty, feebleness, osteoporosis, or just severe low testosterone symptoms. Or again, it helps the heart too. Remember, it supports healthy heart. Then I'll put them on the pellets. And just like Agnes, now she had severe arthritis. She was feeble. She was ready to go in a nursing home. I said, we got to pull out the big guns, Agnes. We got to. So she said, I don't care. I want to stay out of a nursing home. My kids want to stick me in a nursing home. I said, well, let's use the pellets, and let's just have you come in about every 4 months, do your pellets, and then let's put you on a few key supplements. And she was glad. And then as soon as her energy returned, she got on that recumbent bike. Started like 2 minutes a day. And then she was working up 20, 30 minutes, 5 days a week. And that's when literally the weight was melting like butter on a hot stove. And so, again, it just made me recall another lady I just recently saw who is 85. And this lady has some mild dementia, but she looks like she's about 60. Her son takes care of her, and she goes out and she walks 20 to 30 minutes twice a day. She's muscular, no joint aches or anything, no feebleness, no frailty, nothing. And she's on that testosterone and doing absolutely amazing. She's also on our natural thyroid, doing absolutely amazing. So she's on the thyroid and she's on the testosterone, and it's preventing her feebleness. Now, before, when she came in, I first saw her, she had moderate dementia. But that has not gotten worse. And her son helps take care of it. He's just ecstatic. He says, my mom is more active than any other woman her age, 85, that I've ever seen.
Wow.
And she still lives on her own. Her son lives there too. But he doesn't, it's not full-time care. She's active. She's just doing amazing. And that's what we find. And that's the key thing. If we can start our patients on the testosterone soon enough, we can prevent a host of medical problems. Yet most of your doctors, when you go to your doctor and you go in and you tell them, I'm tired, I'm depressed. I got brain fog. I'm gaining weight. Well, let's put you on an antidepressant. It makes everything worse. Let's put you on a statin drug. Your cholesterol's high. That turns your testosterone down even lower. So many people are going to their doctors getting all these meds that are making their testosterone drop even more, and their symptoms getting worse. They're gaining more weight. And also remember that testosterone helps with all the fluids in the body. And so, in other words, if your body's drying out, that's a sign your testosterone's low. And so when we actually put our women on that testosterone cream, we find that all the fluids, their skin starts to be moister. They start to develop, even their saliva, in many of them, their mucus in their stomach, their guts may improve.
Wow.
But their tears, that's a big thing, tears. Every gland that produces wetness dries out when testosterone levels are low, and especially the eyes. If your eyes are dry, you need your testosterone checked.
And that's an important point, what you just said. Don't self-diagnose yourself and try to self-treat yourself. You're going to need to get your blood levels checked. You want to have blood work done so that you know where you are, so you can measure it to make sure you get to the optimized level. And that is what's really, really important. Now, you can call our office by going to our website at drcolbert.com. We have the phone numbers there for both offices. We have a nurse practitioner who can see you through Skype. You're still going to need to get blood work done. And we can help you. Even if you can't get to us, there's things that we can do in order to help you get those blood levels checked. And we want you to do that. And we get the script to you to go to the labs, because you can't just show up at the labs to get your blood work. You need a prescription to get that done. So we'll try to help you as many as we can. But be sure and get a hold of this book, the Hormone Zone book. This has got so much information. You can write through it, mark through it, and it's got so much. There's no way we can give you all the information that this book offers on these podcasts. And be sure and go to our website, drcolbert.com. That's where our supplements are, the different supplements. And we would love, love, love to help you. And please be sure and share about this podcast with friends and family. You'd be surprised the number of people who do not know this, and it could make a life-changing difference to people.
And also send in your testimonies.
Yes.
We hear every day tremendous miracles with this. When you combine, again, the right healthy diet, like healthy keto, with the right hormones, the bioidentical hormones, with the right nutrition and the right mental attitude, and again, always walking in love and forgiving every day, it's amazing how the body heals and the mind heals. And the peace of God comes upon you and you sleep like a baby.
We so appreciate you staying with us for this Dr. Colbert's podcast. And stay tuned to the next week podcast, because we are going to be bringing you powerful information. We're going to be hitting all the hormones, what you can do to live a divine life, because I believe God wants you to walk in divine health. So God bless you.
God
and thank
bless
you
you too. Blessings.